All right, keeping an eye on your health. January is an important month for women, raising awareness for cervical cancer. With us today is Dr. Allison Devine, an OBGYN from the Austin Diagnostic Clinic, to talk to us about cervical cancer and who might be at risk. How common is cervical cancer?
Well, worldwide, cervical cancer is still a leading cause of cancer death in women. Now, here in the U.S., because of pap smear screening, it actually only represents about 1% of cancer deaths. However, that's still about 14,000 new cases of cervical cancer diagnosed yearly and about 4,000 deaths related to cervical cancer.
So who is at the greatest risk here?
So, women that are at the highest risk are women who are not getting pap smear screening, because generally with pap smear screening we pick this up in an early stage and we actually treat it and manage it before it ever develops into a cancer. Another big risk factor is that almost all of these cancers are related to a sexually transmitted virus known as HPV, or human papillomavirus.
Okay, and so is there a way to prevent? Is it a genetic thing, or is there a way to prevent it ahead of time?
Generally, it's not a genetic problem like some other cancers. It really is an infectious disease. It's really caused by obtaining the HPV virus and then having a prolonged infection. And one thing that can allow for you not to clear the infection is something like cigarette smoking. So certainly quitting smoking is a way to prevent it. And also now we actually have a vaccine against HPV, which is recommended for women and men now ages 9 to 26.
So this is a preventable thing. If someone has cervical cancer, what are the treatment options?
Well, again, I like to stress that we like to treat this before it ever becomes cervical cancer.
Sure.
And if it's picked up in the early stage, which we call dysplasia, we can generally treat it in the office with an excisional procedure or with something called cryotherapy, which is an ablative procedure. If it develops to cervical cancer, that's managed by a specialist, an oncologist, and it generally requires either a hysterectomy or radiation.
And if we're talking about pap smears regularly, at what age should they start and how regularly?
The current guidelines recommend starting pap smears at age 21, and then after that it depends on whether or not your results were normal, but your doctor should come up with a protocol that's appropriate for you.
Okay, Dr. Devine, thank you very much. Good health tips.